Hello, I am John O'Brien from the Keystone Contractors Association. And for this year's Construction Opioid Awareness Week, we are recording some videos for the industry to utilize and get some information from. And I am excited about today's video. We feature Brand Newland from Goldfinch Health. Brand, how are we doing today?
Doing well, John. Thanks for having me.
That's good. You want to take a quick minute to introduce yourself?
Yeah, I'll make it short. So my name's Brand Newland. I'm the CEO and co-founder of Goldfinch Health. We help people through surgery and recovery, especially around pain management and minimizing opioids. I am a pharmacist by training.
Awesome. Nice to meet you. And I'm looking forward to today's conversation. I have a few questions I'd like to ask you, and these are some questions we get a lot from construction workers. Um, I'm just going to start firing away, and we'll hear your
Yeah.
thoughts. So, yeah. So, what are some risks associated with surgery related to opioids?
As I got really into surgery, digging deeper 7 years ago when we started Goldfinch Health, I was surprised by just how important a role surgery plays in first exposure to opioids and long-term use of opioids, unfortunately. That somewhere between 6 and 9% of folks who go through a major planned surgery, so almost 1 in 10 people who have a knee replacement or shoulder surgery or even cancer-related surgeries or in women's health, hysterectomies, mastectomies, those types of procedures end up as long-term users of opioids. And frankly, no one goes into a surgery wanting to be a long-term user of opioids, right? This is an outcome, an adverse outcome of surgery that happens to people before they even realize what's coming. So that got us really motivated to try to do something about this and arm folks who are headed towards surgery, families who are headed towards surgery with some resources and questions and knowledge about what they might do as they approach surgery to avoid becoming a statistic.
Interesting. Very interesting. So, if someone does have surgery on the schedule and it's coming up, what are some and assuming they have they have concerns about opioids, what's something they can do, prior
Yeah.
to.
Well, we work with thousands of patients, and honestly, almost everyone has some concern about opioids in this day and age. There are certain folks who have a heightened risk and thus are more concerned, maybe because of personal history or family history or history with coworkers or friends. But everybody's got some concern about at least the pain part of surgery, right? That's the big scary part of and the unknown part of what this is going to look like. The first thing you can do as you prepare for surgery is just be aware of this risk. That, I think listening to this is a good first step. That this is something that is that can be discussed. There can be modifications made to pain management now. We know a lot more now about pain management, and it doesn't just have to be about opioids. The second thing is be comfortable asking some questions. Be comfortable asking a question about what does the pain look like after surgery for this type of procedure? What should I expect? Will I need opioids? Or do some people manage without? For how long? That starts to create an expectation. So, if I have some pain on the first day or two after surgery, well, that's just what everybody has. It's not something I should be panicking, and that pain can be helpful. It can protect us from doing something we shouldn't do on those first days after something like a surgery. The other really important point to know is that alternatives to opioids can be really useful and really powerful. One thing that surprised me, even as a pharmacist, we didn't learn this in school, uh, and that is that acetaminophen, which is Tylenol, and Advil, which is ibuprofen, when used in combination around the clock, especially after something like a surgery, but could also be after an injury or other painful episode, they're 3 times more effective than oxycodone, which is an opioid, for pain management, and don't bring with them the side effects, including addiction, that come with use of opioids. Opioids have other side effects as well. They mess with your hormones. They can put you at risk of blood clots. You've constipated, all of this stuff, right? And then addiction and long-term use, the longer you use it. So there are other options. We even give folks that we're supporting in our programs this little device called a VibraCool that you can strap to an arm or a leg, and it vibrates at a certain frequency. It basically distracts your nerves along with the ice pack. that works and has reduced exposure to opioids for patients who use it. But it's also just a good sign that there are other things that we now know can work besides putting an opioid in your mouth and taking it for months on end.
Yeah, good points. Are there any concerns or something that people might not be thinking about that you hear a lot about?
Yeah, John, I'm glad you asked that. And I'll make this the last point to make this short and sweet today. There is one thing that we put a lot of focus on beyond the experience right around the surgery, and that's related to leftover pills. Uh, Most everybody gets a prescription for opioids going through surgery, and that's perfectly fine. Use of opioids for a few days is totally appropriate for many folks who are going through surgery. It starts to get a little more dangerous in terms of long-term use and dependence after about day 5 of use. And most people, we can help through that, and if they're aware of it, they can be done with opioids and focusing on more acetaminophen, ibuprofen, alternatives by that day 3 to 5. Then you have leftover pills. And that's the point that I wanted to make that is maybe a little bit of an overlooked danger. I was surprised to learn that the number one cause today of inadvertent accidental childhood poisoning in our country is leftover opioid pills. And when I grew up, everyone was concerned about chemicals under the sink and that kind of thing. That's not the number one cause of poisoning today. It's leftover pills.
Huh.
The best thing you can do is get rid of them. So you don't use them, nobody else uses them, whether it's somebody in your family or it's somebody in your home doing some work or whoever it may be, a family member who's visiting, just get rid of them. And there are tools out there. We give folks the Terra pouches, which deactivates the pills and you can dispose of them in your garbage. There may be take back programs in your community you can take advantage of. Whatever the way, the mechanism is for getting rid of it, it's just best to get them out of the house because they can be dangerous for folks who don't know what they're getting into, and unfortunately, some folks who know exactly what they're getting into who may be seeking them.
Excellent points. Yeah, I didn't know that about the stats. So it's crazy, crazy what's going on. But yeah,
Yeah,
thanks for sharing. Yeah, thank you for your time today, Bran. Goldfinch does a great job. Please keep it up. You have a lot of great resources on your website. We're going to make sure to get that out in the comment section. So check out Goldfinch Health. And thank you for your time today, Bran.
appreciate that, John. Thank you.